Well, we'll go ahead and get started. Be respectful and mindful of everybody's time. Yeah, thanks to everybody for being here. We are very fortunate today to be spoken to, taught by our very own Dr. Kris Dean, who is a board certified specialist in clinical psychology. She's an associate professor in the Department of Family Medicine at the UT Graduate School of Medicine, and she is a director of our very own Center of Excellence for Children in State Custody, as well as being an adjunct researcher for the RAND Corporation. She's a national trainer in cognitive behavior intervention for trauma in schools, or CBIT, and in Bounce Back program, and she co-authored the Support for Students Exposed to Trauma SSET program. She is on the executive board of APA's Division 37 section on child maltreatment, and together with her COE colleagues, she and community partners, she obtained a SAMHSA grant as a Category 3 site in the National Child Traumatic Stress Network, which I'm sure you'll hear from us over the months and years to come as well. But we're very fortunate to have her joining us today to talk to us about problematic sexual behavior, how to work with children and families. Thank you so much, Dr. Dean. I'll let you take it away.
Thank you, Dr. Corwin. Good afternoon, everybody. As Dr. Corwin said, thank you for being here today and for sacrificing your lunch hour on a Friday to hear about problematic sexual behavior. We're going to just go through some basic kind of guidelines issued by several different entities, experts out there, about kind of what is problematic sexual behavior, sort of delineating what's normal, what's not normal, what's healthy, what's not healthy. And then once we do that, kind of talking about how do we work with families when this is an issue. So if you have questions as I'm going, please feel free to unmute yourself and ask, or you can drop it in the chat. We will have people monitoring this for us so that if I don't see somebody will let me know, and we'll make sure to get to your questions. Also, we'll have some time at the end to answer questions as well. So we want this to be helpful for you, okay? So just to acknowledge my sources, the ATSA Task Force on Children with Sexual Behavior Problems issued some guidelines in 2006, and they've kind of been the industry standard about how to address sexual behavior in children. In Tennessee, we had our own work group several years ago. We kind of took those guidelines and made our own that were very similar. And then Tony Kavanaugh Johnson is a psychologist in California who's produced a lot of literature around this, and some of it includes like books for parents, how to talk to kids about sex, just some helpful information. And so I've stolen some of her information as well for these slides. So I want to start by just getting your input on what you think the difference is between healthy sexual behavior or sexual behavior problems. Does anybody have any thoughts about this? You can shout it out or you can drop it in the chat. Like what's kind of that line? How do we know if a sexual behavior is a problem versus something that's kind of normal, a normal developed behavior?
This is Courtney with the McNabb Center. With my new program, we have come across a lot of sexual reactive behaviors, which periodically through my career I've dealt with it or come across it, but for some reason, this new position, we've come across it quite often. And so when we meet with families, I explain, because some people are like, well, he shouldn't be doing that. And it's like, well, how do I discern whether or not a teenage boy, because I've never been a teenage boy myself. So how we determine it is looking at how it affects their life domain. So if it's negatively affecting their family life, their school life, stuff like that, that's kind of the go-to in the beginning of sexual reactive behaviors for us anyway.
Yeah, thank you, Courtney. Thanks. That's absolutely right. Is this interfering? Is what they're doing causing problems for them? Is it causing problems in their relationships, with their family, at school? That's a great general guideline. Any other thoughts? Anyone else have thoughts about that? How do you discern healthy from unhealthy sexual behavior? My one of my former colleagues at the COA, our former director, used to say, most people don't like to hear sex and children in the same sentence, right? So some people think sexual behavior in children, period, is not okay, right? And we know that actually most kids will engage in some type of sexual behavior. Dr. Corwin puts in the chat, yeah, something that's causing harm, that's unhealthy. Good. So we're going to go through some of these. You guys get the general idea. So a couple questions. Tell me your thoughts. What % of kids do you think will engage in some type of sexual behavior by age 13? Any guesses? Again, you can shout them out or put them in his chat. 70%, 80%, 75%, 60%. Good guesses. 80%, 70. Okay, good. So most of you are above 50%. Yes, yes, that's true. It's 85%. Vast majority of kids are going to engage in some type of sexual behavior before they're 13, right? All right, true or false? Child sexual behavior occurs on a continuum. Is it just yes or no, or are there a continuum of behaviors? What do you think? Yes, true. Very good. You guys are brilliant. You already know this stuff. Yes, it's true. There's a continuum of behaviors, right? It's not just any sexual behavior is bad behavior, right? There's a continuum of behavior depending on the child's development and a bunch of other factors. So sexual behavior is influenced by a lot of things, right? The age of the child, how old they are, where they are developmentally, what their family's sexual behavior has been, right? What are the norms in the household? What are the things that they see? What are the things that they're taught? What is their family's religious beliefs? And how does that impact the family's beliefs about sex and sexuality? What are the cultural beliefs and values around sex and sexuality? So lots of different factors affect sexual behavior in children. Okay. So there are some common characteristics of healthy sexual behavior. And yes, there is such a thing. There is healthy sexual behavior, right? All human beings engage in some type of sexual behavior. And so our goal for our kids is to have healthy sexual behavior, right? Behavior that is normative for their age and that follows sort of their developmental trajectory. So some of these characteristics. That kids engage in this behavior as a way to gather information. Okay, most kids approach sexual behavior from a place of curiosity, right? Just like they're curious about everything else in the world, right? They're curious about sex, they're curious about bodies, they're curious about body parts. That's how they learn, right? Our kids are curious and that's how they learn. And so the same is true for sexual behavior. They're approaching this not from a place of sex as we think of it as adults, but from a place of curiosity and information gathering. Healthy sexual behavior will include behavior among their peers, right? Kids that are of the same age, the same size, developmentally at the same place, okay, sort of curiosity with each other. That's typically what we see in healthy sexual behavior. It's voluntary and it's mutual. Okay, if it's healthy, it's both kids being curious. It's also limited in type and frequency. Okay, we don't see among healthy developing kids, we don't see a lot of sexual behavior. Okay, we'll see it once in a while in certain circumstances, but it's usually pretty limited, especially when they're redirected. Okay, I'm told, yeah, we don't show our body parts in the middle. Okay. It occurs in different periods of life. So kids of all ages will engage in different kinds of sexual behavior. And as I mentioned, if they're redirected, usually the behavior stops. So if the parent sees kids, showing each other body parts or touching each other's body parts, and the adult says, yeah, that's okay, we don't do that, right? We don't show our body parts, tells the child, then usually that's the end of it. If it's healthy sexual behavior, and oftentimes they're embarrassed, right? They sort of recognize if an adult discourages them, they feel embarrassed by it, and they usually don't do it again, or won't do the same thing again. So that's pretty common among just healthy sexual behavior in general. Are there any questions or comments about that? Okay, so let's look at some examples. Right, you might be thinking, well, what is age appropriate at certain developmental stages? In this talk, we are talking about kids under 13. Okay, so we're talking about children. So preschoolers, what are some examples of healthy sexual behavior among preschoolers? Anybody have an example or have a thought about what might be a healthy sexual behavior among preschool age kids? Touching their private parts, absolutely. A friend of mine, I love this story because I did not have kids at the time, and she had like a 3-year-old, or he might have been 2. Anyway, she was doing something in the bedroom, and she walked into the living room, and she found him there on the couch, and he was touching his penis, and it was erect, and he had never seen that before, and he was so excited and could not wait to tell her about it and to show her. He said, "Mom, look what it does." And she felt horrified at first, and was trying not to react or make a big deal of it. But she was like, "Okay, that's nice, honey. Go ahead and put that away. Go wash your hands for dinner." And she, just kind of handled it and moved on. But very normal, healthy behavior for a 2 or 3-year-old, right? To notice their penis, to touch it, to get excited when it moves, okay? Very typical, normal. Another comment in the chat about noticing the differences between male and female. Absolutely. Yeah, noticing those differences and commenting on them. And even differences among people. So my youngest child, she noticed my sister came to visit, and she, for whatever reason, kids, they're, my husband and I are, we're pretty comfortable with body parts and talking about that sort of thing with our girls or whatever growing up. And so my sister came to visit, and she, I'll just say, is much more well endowed than I am on top. And so my daughter made this huge deal of it. She saw her and went to give her a hug, but she just grabbed her, like she grabbed her breasts immediately. And my sister, sort of blushed and freaked out. And I was like, "No, honey, we don't touch other people's body parts." We had to have that conversation. But it was like, "Oh, wow, this is different, right? This is not like this." And so that was her very impulsive, very toddler reaction, right, to seeing those body parts. So not unusual for adults to do that. Okay, so touching their own genitals was mentioned. Yes, very, very common. It could be at any time when they're excited or when they're tense, during a diaper change. It's very normal. Touching private parts of familiar adults and children, like my daughter with her aunt. Okay, this is new, this is different. I'm curious about this, right? Liking to be nude or liking to watch others who are nude. So sort of being fascinated with nudity or not having clothes on. I had a friend whose son would take his clothes off the minute he got home from preschool, like could not wait to get his clothes off, like all of them. He would just strip down, didn't want to have his clothes on. Dana Carvey, who's a comedian that some of you might know. If you're older, you know him. I don't know if younger folks know him as much, but he was on Saturday Night Live, and he had his own, stand-up routine. And he would talk about his kids liking to be naked. He was like, "Oh my gosh, it's like naked time," because I've never seen kids more excited to be naked than my children. Right? Pretty normal, healthy behavior. They're interested in the bathroom, toilet, feces, urine, like this is all very exciting and kind of new stuff for them, and especially as they're toilet training, just being interested in those things as well. Curious about that. Curious about other people. So in public restrooms, those of you who have used public restrooms, you probably had the experience of a young child trying to look under the door, right? They're curious, like, what are they doing in there? It's a whole new world, right, around toilets. Playing doctor, looking at other people's bodies, right? Being curious about other people's bodies. This is a nice example. This little boy says, no, you can't touch it. You already broke yours, right? So that's different. I'm noticing yours is different than mine. And what is this about? Okay. So common kind of behaviors among toddlers. What about a little bit older, through about 4th or 5th grade? Any thoughts about this? Any ideas about normal, healthy sexual behavior that we might see in elementary age kids? Probably some of the same things we talked about, right? Some of that might continue. Other things you might think, if they get a little older, a little cognitively, a little more sophisticated. Well, talking about it more, right? Asking more questions. Why are these different? What does that mean? What is sex? Where do babies come from, right? I want to have a baby. How do I have a baby? Okay, so a lot of more talking, more curious about it, starting to think about these things in a different way. They might be talking to their friends about things related to sex, or they might start wanting to have a boyfriend or a girlfriend or some kind of relationship, right? I want to get married. Sometimes kids in elementary school will talk about wanting to get married or wanting to marry their parent. Freudian stuff can come up during this time, right? We start to see that they recognize that parts are private, and so they start to want privacy when changing. And I remember just with my own kids when that shift kind of happened, when they were pretty open with everything for a while, and then it's like they start to recognize, like, oh yeah, I'm going to start shutting the door when I'm in the bathroom. I'm going to start shutting my room when I'm changing. Kind of recognizing that, wanting that privacy. They might compare genitals with their peers, right? So with their friends, it's maybe less with kids that they got opposite gender, but maybe more with peers. They start comparing body parts. I know for girls, when they start to need to wear a bra, that's a big deal, and they'll talk to their friends about it in elementary school. Who's wearing a bra, who's not? Those are kind of common things that you might talk about. They might, again, still be curious about nudity, maybe recognizing that I can't see people naked just all the time, maybe in magazines or other places like pictures. So having curiosity about that. And again, having erections, for boys, starting to have erections, and being curious about that and what that means. Okay. Let's take a look at an example, just kind of a funny example from a movie about kind of normal curiosity among kids.
That's what it looks like? I guess. What does yours look like? Not like that. Yeah, let me see. All right.
Gertie, it's time for Brian to go home. Okay.
What are your intentions?
Huh?
What are your intentions with my daughter? Do you plan on marrying her?
I don't know.
Well, only married boys and girls show each other their material parts. Okay? Okay, Brian. You can go now. Come back with a ring.
Yes, Mr. Trinky. Bye, Gertie. Bye.
Goodbye, Brian. Okay. Do you have any questions about what you whatever. So.
Do you have what Brian has?
Yes, I have one, two.
Is yours as big as his?
Sadly, yes.
Can we rent a movie?
Yes.
Okay, so just, that's a normal example, and all parents have had those moments, right? What do I say? What do I do? This is awkward. The dad in this case, did the right thing, told them that's, we don't do that. That's not okay. And he invited a question from her, let her ask her question. So it can feel awkward, but just to know that it's normal when you're working with families to help them understand what's normal and what's not normal. Okay, so let's talk about when we should be concerned, and you guys were kind of right on in saying when it's causing problems, right? So some examples: if that behavior continues after the child's been redirected, you told them not to do that, you've told them it's not okay, and it continues to happen. If the child is preoccupied with this behavior to the exclusion of other things, so they're not doing other things with their friends, they're not engaging in other activities, they seem preoccupied with it. If there's any distress around healthy touch, so if kids have a real negative reaction to, a normal hug or any kind of touch that we would consider typical or normal, if they have experienced some distress about that, then we want to pay attention to that. If they have inappropriate boundaries with unfamiliar people, so being too willing or too eager to jump into someone's lap or to touch them or let them be touched with somebody that they don't know very well. So sometimes we'll see this with our kids, right, where they don't seem to recognize that that's not okay, or they don't have any sense of like stranger wariness, right? Or if they're engaging in sexual behavior that is aggressive or manipulative, right? So we talked about with healthy sexual behavior, it's mutual, it's voluntary, right? When we should be concerned if that behavior is a child forcing another child to do something or manipulating another child into doing something that they don't want to do. Okay. Okay. So some facts about kids that do have sexual behavior problems. So again, remember the continuum. So this behavior occurs on a broad range, right, of severity. So, even concerning sexual behavior among kids may or may not be severe, right? And so we have to kind of address each instance and what they're doing, but there still is a range. Oftentimes, sexual behavior among kids is really driven by confusion or fear or anxiety, right? It's not really driven by sex in the way that we think about adult sexuality, right? It's less about sort of wanting sex for that sake. It's about, I don't know what else to do, or I'm trying to soothe myself and I can't do that in other ways, or something that I've been shown or taught that this is how we show affection for other people. So it's coming from a very different place. It's usually not about arousal in that sense. So this is a different population than our adolescents or adult sex offenders as we think about it, right? It's coming from a very different place than that. And most kids are really at a very low risk of future offending, especially if they get treatment. And that's something that a lot of families worry about, that we can help educate them about, that a foster parent gets a child in their home and they're masturbating a lot, or they're curious about sex, or they're doing other kinds of concerning behavior, and the parent says, wow, is this child going to grow up to be a sex offender? Or is this child going to be, X, Y, or Z? And so we want to be very careful not to label kids, and to let families know that this behavior can be modified, just like any other problematic behavior that kids engage in, and that it doesn't mean they're at risk for becoming a sex offender as an adult. Okay, so let's look at some examples of problematic sexual behavior among kids, things that we would be concerned about. So under preschoolers, touching their own genitals, which we talked about being normal, but if they're doing it to the exclusion of other activities, or if they're doing it so much that they're hurting themselves, right? Then that's a time that we want to be considered. We want to be concerned. If they are being sneaky about touching others or demanding that others touch them, so we talked about, if they're being aggressive or manipulative, if they're being kind of sneaky about it, there's a recognition they shouldn't do it, but they're doing it anyway. Just refusing to follow commands around sex or sexual behaviors, refusing to get dressed when they're told to, again, sneaking around after they've been reprimanded, refusing to leave others alone in the bathroom. You tell them to leave, or you tell them not to look under the door, and they continue to do it. Again, it's that sort of not listening, not responding to the redirection from adults, forcing others to play doctor or undress. So these would all be examples of problematic behavior that we might want to seek treatment for. For older kids, our elementary age folks, not just the normal curiosity, we expect elementary age kids to have questions and to ask questions, but maybe asking questions like to the point where they just don't seem satisfied with whatever answer you're giving them, and they just want more and more information, or they know more about sex than they should at their age, right? They're more aware of body parts or actions, or they know things like related to adult sexuality that we wouldn't expect an elementary age student to know about. They're talking about sex habitually, again, not responding to that redirection or not sort of being satisfied with answers that they're given. If they're either really aggressive or really fearful in their demand for privacy, so having a really strong reaction to privacy issues, somebody coming in their room or knocking on the bathroom door, they have a very intense response to that. Comparing genitals with kids of other ages. So we talked about how it's normal for kids to be curious and to want to show genitals or look at genitals of their peers. And like in the video clip we saw, right? Same age, same developmental level. But if they're doing this with older or younger kids or being demanding about it, that's more concerning, right? So if there's a differential in the power level or in kind of their aggression or demands to engage in that behavior. It's not same age, it's not voluntary. For elementary age kids, masturbating to nude pictures, so it sort of moves beyond, I'm just curious about naked bodies, now I'm masturbating to them, or I'm displaying them, especially after being told it's not appropriate. Okay, so just kind of another level of sexual behavior. And with erections, again, we talked about erections are normal, but if they're having prolonged erections, or it's painful, or if they have an intense fear of their own penis or erection, then that's something that we would want to explore further. So if we have concerns about a child's behavior, then we want to do some investigating, right, and do an assessment to get more information about where is this coming from, sort of what's the extent of this, so that we know what to do for treatment, right? So for the child, it's important that that we assess the child and the caregiver if possible, right? So for the child, we want to look at the specifics of the behavior. So sometimes, we see this a lot at the COE because we review a lot of records. And so we'll see like reports of a child engaging in sexually reactive behavior or problematic sexual behavior, but there's not a description of what it is. So we don't know what that means, right? So it's really important to get as much information as you can about specific behaviors, what was going on, who was there, how long did it last, what was the response to their behavior? As much information as you can get, because as we've talked about, this happens on a continuum, right? And we don't want to assume something is severe if it's not, and vice versa, right? So getting as much information about the specific behavior as possible. And, was this a one-time thing? Has this happened multiple times? Has the child received redirection or education, etc., right? History. So one of the first things you think about is what when a child is engaging in problematic sexual behavior? What's one of the first questions? What's one of the first things you want to know if a child is engaging in problematic sexual behavior? You can just shout it out. Or type it.
How long has it been going on?
Yes, we want to know how long it's been going on. What do we want to know about their history?
What age did it start?
Yeah.
Have they been abused?
Yes, have they been abused, right? They're engaging in sexual behavior. Have they been sexually abused, right? So what is their abuse history? What are things like at home? What are the boundaries? What do they see in their families, right? Are they exposed to things that children probably shouldn't be exposed to, like pornography or sexual activity among adults in the home, right? What's happening at home? What are the boundaries at home? What's the child's emotional state? Are they distressed? Is this causing them a lot of distress or not? Or does this seem to be kind of normal for them and they don't recognize that this is not typical? What are the child's thoughts about sex or sexuality? Just asking the child about the behavior. Why are they doing that behavior? What are their thoughts? What do they know? What have they been told, right? What's their knowledge? So as much information as we can get, the more information we have, the better we're going to be able to target the behavior and treat the behavior effectively. Okay. The caregiver. So we want to talk to the caregiver, right? What's going on at home? We want to know the context for this child's behavior. So asking the caregiver what the boundaries are at home. You might hear different things from the child and the caregiver, maybe not, but asking the caregiver, what are the boundaries? What are the rules at home around sexuality and modesty and privacy? Asking them about their own childhood home. What were things like for you growing up? What were the boundaries like in your home? What was your understanding of sex as a child? Are they bringing with them what they were taught in childhood, and how is that translating into their current home? What are their values, attitudes, and feelings about sexuality? Are they what end of the continuum does the family fall on? What do they believe? What is their attitude about sex? Their own history. So is this a parent who engaged in sexual behavior as a child, or were they abused as a child? How does that play into their current beliefs and what they're teaching kids? Okay, so we want to get as much history and information about the child and the caregiver and the home, the caregiver's history as we can. Again, the more information, the better, right? The better we're able to target treatment. So a couple things about child sexual behavior problems. Sexual behavior is a learned behavior that can be unlearned, okay? Just like a child who is aggressive and hits, right? We can teach them not to hit. We can teach them other coping skills. We can do the same thing with sexual behavior. Again, talking to families, this does not determine the child's future. This does not mean they're destined to become a sex offender. We just have to teach them other strategies. We need to teach them other behaviors. The majority of kids with sexual behavior problems respond very well to treatment. So I will not say that everybody does. Obviously, there are different circumstances and different kids and different issues. But the research tells us that most kids who display sexual behavior problems will respond to outpatient treatment. They don't need to go to a residential treatment. They don't need specialty treatment. If you have a good child therapist who knows behavior management, this can be very effective treatment. Also, labeling a child as a sex offender is inappropriate and inaccurate. So as I mentioned, kids engage in sexual behavior for a number of reasons. It's not usually out of arousal or in the way we think of adult sexuality. So it's really inappropriate to call them a perpetrator or a sex offender. Okay, so we really try to avoid those labels, and instead we label the behavior. It's problematic, right? It's sexual behavior and it's problematic, but that doesn't mean the child is a sex offender. And along those same lines, the treatment is different than it is for adults. So we don't have sex offender treatment for children. Okay, it's just not appropriate. So we don't include things, for those of you that are familiar with sex offender treatment for adults, some of the elements that are included in adult sex offender treatment are not included for kids. Like we don't do relapse prevention, education, and cycles. We don't talk about abuse cycles. Again, kids don't go through that. They don't have sort of cycles of abuse in the same way that adults do. Admission of past offenses is a requisite. Is not usually indicated either. That doesn't mean that we don't help the child understand how that behavior is not okay and that they should not do that behavior and that they need to take responsibility for that behavior. It just means we don't do like that they have to, have this come to Jesus meeting and admit their past offenses and all of that to move forward in treatment, because young kids don't understand that necessarily. So we focus on helping them shift that behavior to something healthier and less harmful, right? And help them understand that that behavior is not okay, but it's not about them sort of coming to terms with all their past sins, if you will, in the same way that we do with adults. Okay, does this make sense? Are there questions about that? Okay, so what does evidence-based treatment look like for kids? So most of the models out there are really kind of CBT-based models, cognitive behavior therapy, where again, we're teaching a new behavior, sort of heavy on the behavioral, and especially depending on the age of the child. For our younger toddlers and young kids, it's going to be very behaviorally focused, environmentally focused. With older kids, we can do more cognitive stuff, helping them understand what they're thinking and feeling when they do that behavior, and finding other ways to help them feel better and help them understand things differently, so that they recognize there are other things they can do. Psychoeducation is a big one for the child and the family, especially for parents, helping parents understand where this behavior is coming from and what it means, and how we can shift it. Caregiver involvement is really essential. So just like with any child treatment, all of us who work with kids know the importance of caregiver involvement, right? They're the ones who are going to kind of establish the new environment at home, reinforce the rules, help coach the child on using new coping skills. I mean, the parent really has to be involved. We can't just pull a child in on their own for individual therapy and say, stop doing this, right? We need that adult support to change those behaviors. There's been some research looking at some group interventions versus individual interventions for this population, and they have found that it really doesn't seem to matter if you're doing individual work with a family versus a group setting, as long as you're doing those key components and including the caregiver. And I mentioned this already, but intensive or residential treatment is rarely indicated for these kids. And again, it's not to say that there aren't those kids out there who need this, but it's less common that they would need it. Most kids can do this in an outpatient setting. All right, so what are some of the components of good evidence-based treatment? First and foremost, safety, right? Of course, we have to make sure everybody is safe. So if this is a kid who is engaging in sexual behavior with other kids and is displaying some of that aggression or manipulation, we want to make sure that other kids in the home are safe and that that child is safe. So we work with the caregivers, right? They're the ones who are going to enforce the safety plan. So helping caregivers with supervision and monitoring. So what are the rules around supervision? Does the child need to be in the same room as you? Does the child need to be within arm's length of you? Okay, this is going to vary depending on the child and depending on what their behavior is, right? But we want to have very clear rules about supervision and monitoring. You know, do we need to have cameras? Do we need to have alarms on the doors? What is that going to look like? And making sure we're communicating this with all the caregivers. So if a child is, you know, spends half his time with mom and half his time with dad in different homes, we need to make sure that both parents, both homes are following the same rules. If he spends weekends with grandma, grandma's got to know what the rules are, right? There has to be consistency among all the caregivers. And we also want to help families know that this can be modified over time. So, you know, maybe at first, Johnny or Susie does need to be within arm's length, like you have to have eyes on them at all times. But that's going to change as their behavior changes, right? As they start to modify their behavior and they are acting out less and less, then you can change the supervision and the monitoring, right? I mean, our goal is to get them back on track so that they don't need that level of supervision. And we want to be able to modify those behaviors and change those coping skills so that they are able to function and so that it's not interfering, right? That's the goal of treatment. So letting families know that, like, we're going to monitor this over time. We're going to see how they're doing. We'll change the rules. We'll gradually give them more privileges and freedom and rewards as their behavior changes, right? The education we talked about, educating parents about the difference between healthy sexual development and problematic sexual behavior. We want to make sure there are rules in the home around privacy and what the child can and cannot do. Right? What is okay? What's an okay touch? What kind of touches can you do? What kind of touches can you not do? Regarding masturbation, a frequent behavior problem we see. When and where can you do that? And working with the family on that. Is it okay for them to do that in their bedroom with the door closed once a day? Or whatever the rule might be, right? Really help them get as concrete as possible about what's okay and what's not okay and communicating that to the child. Because the better the child understands it, the more likely they are to comply with the rules. And along with that, you know, helping them understand what contributes to and what maintains sexual behavior. You know, do they tend to do this when they're reminded about things at home? Do they tend to do this when they're anxious? You know, what seems to trigger the behavior? What can we do to change those triggers and or give them new coping skills? So that they know there's other behavior they can do. Okay, so a lot of work with the caregiver. Also sex education and kind of how to talk about sexual behavior with kids. So we as adults like to avoid this because that makes us uncomfortable to talk about these things with children, right? We already kind of talked about that even with kids with healthy sexual development. So helping caregivers be able to talk about this. So if they're not sure how to talk about it, you know, help them with that, help them come up with a plan. And there are some great books like the Toni Cavanaugh Johnson psychologist that I mentioned. She's got some good books about that really gives parents kind of a step-by-step. How do I talk to my child about sexual behavior and healthy sexual development? Doing some things to just improve the parent-child relationship, right? So things have been tense, and if this child is like engaging in sexual behavior and the parent is either embarrassed or upset or angry about that behavior, which is not unusual, right? For parents to feel a lot of distress around that behavior, sort of being very purposeful about putting them together in situations where they can improve their relationship, you know, have them do special playtime, to borrow from PCIT, or just time together where a parent can just enjoy their child and it's not about them correcting their child or being upset about the child's behavior. Supporting the child's use of self-control strategies. So, you know, if you're feeling anxious, use your stress ball or come tell mommy or take a time out or do some breathing, right? As we're teaching kids coping skills, having the parents really reinforce and praise the use of those coping skills And also reinforcing when the child does not engage in the problematic sexual behavior. You know, if they make it a whole morning without that behavior, or a whole day, or whatever it might be, for the parent to really praise that and reinforce that. I'm so proud of you. I'm so proud of you for not doing that today. You really had some good self-control. I like how you're using your coping skills. And then, of course, modeling appropriate physical affection and building relationships with the child. This is especially important, you know, kids coming into foster care where maybe they haven't been in a home with good boundaries, they haven't seen appropriate affection among family members. And so modeling that for kids and labeling that and talking about that. Yeah, in our family, we give hugs, and this is what our hug looks like. We might do fist bumps, high fives, like what does that look like? And sort of modeling that for them and helping them see. It's not that you know, we don't want to teach kids or give them the message that it's not okay to touch people or it's not okay to be affectionate at all, right? We want them to have healthy, affectionate relationships. And so helping the caregiver model that for the child. Also guiding them toward positive peer groups, right? We want them to interact with peers. We want them to have friends. And so helping them do that in a healthy way. And, you know, if we're providing adequate supervision and monitoring, then we can do that. We can get kids back to those healthy relationships. Okay, just some guidelines about talking to kids about sex. So first of all, you know, try to answer their questions. Like, don't just ignore them or blow them off or give them, you know, tell them it's a store or whatever. Like, try to answer their questions as best as you can with, you know, age appropriate information. Doesn't mean tell them everything, right? Tell them, you know, be able to answer their question at an appropriate developmental level. So you want to be matter of fact and straightforward. I tell parents, even if you're feeling nervous, try to portray that you're calm and this is no big deal. Okay. We don't want to make it seem like a big deal for kids because that can seem frightening or they won't, you know, might not understand that. So just be matter of fact and straightforward, you know, at their level, sit down with them, make eye contact, right? Be good listeners. We encourage families to use proper anatomical names. So just a body part is a body part is a body part, right? Just call it what it is, like demystify it, take out the stigma or the scariness or whatever. If we use other terms for body parts and we're not naming what they are, it sort of like mystifies it and makes it seem like we can't talk about it or it's not okay to say that. You should be ashamed of that body part even is a message that we can give kids around that. So using proper anatomical names just really normalizes it. You know what? Yeah, everybody has this body part. You know, most men have a penis. Most women have breasts. That's part of being a boy or a girl. We certainly want to avoid teaching that sex is bad, right? So again, we don't want to teach kids that you can't have affection or show affection towards people. We don't want to teach them that you can never have sex, right? Instead, we want to give them the message that, you know, that kind of sexual behavior or adult sexuality is for when you're older. You will have plenty of time for that when you're older. Right now, we want to focus on growing up and learning and being healthy with their friends. We also want to teach them that every person makes choices about their own bodies. So including them, like they make choices about their own body and what they do or do not want other people to do. And their friends and their siblings and other people have that same right. And everybody has a choice. So you can't choose what to do to somebody else's body because they have the choice of what happens with their body. And same with you. Like you have the choice over what happens to your body. Okay. Questions about that? For the education of parents, helping them talk to kids. For the kids, for their side, that kind of education. So helping them recognize the inappropriateness of the sexual behavior and apologizing. So as I mentioned, we do want them to recognize it's not okay and to take responsibility and even to apologize. But if that's not the same as, you know, going back over everything that they've ever done since the beginning of time. I was working with a family where an older brother had inappropriately touched his sister and he was removed from the house. He was he was a few years older, and I can't remember, 3 or 4 years, I want to say. So he was placed with a relative. But he started therapy. They got referral therapy. She went through TSCBT. He saw his own therapist, and they had agreed that both kids were doing well, and both kids wanted to be back together as a family. Like the parents wanted him back in the home. He wanted to be back in the home. The girl even, she was sort of the key, right? But she said, yes, I want my brother back. I miss my brother. And so, so I was asked to do some family therapy sessions with them to help with reunification. And so we would do family sessions, and one of our goals was he wrote an apology letter to her. And so we sort of rehearsed, like you would do in TSCBT with a narrative or something. We sort of rehearsed his letter and what he wanted to say, and he practiced it, and then she practiced how she would respond to him. And so he apologized, and she forgave him, and they reunified. And it was a nice kind of success story. So we want that recognition and apologizing for the behavior as well. We want to educate them about the boundaries, the rules about sexual behavior. We kind of talked about, you know, the kids need to know what the expectations are so they can follow them. Doing that age-appropriate sex education about body parts and what they're for, and again, answering their questions. Teaching them coping skills and self-control strategies, right? They need, if I can't do this, what am I going to do? We need to give them alternatives. We need to give them those tools to use. Doing some sex abuse prevention and safety skills. This is really important for those kids who have been sexually abused and who are engaging this behavior. We want to reduce the potential for them to be victimized again. So talking about personal safety skills, the fact that they own their body, they have the right to say no, who to call for help, you know, all those kinds of skills we want them to learn so that they can hopefully be confident in their ability to not have this happen to them again. Or if it does happen, they know what to do. They know that it's okay to tell, etc. And improving their social skills. So, you know, if they have been taught, or they think that you know, the way you let somebody know you like them is to touch them inappropriately, we have to teach them some replacement skills again. So, you know, teaching them social skills, how to talk to their peers, how to play with their peers, what's okay, what's not okay. Okay. So the last thing I have is just a list of resources. So kind of my favorite website for around problematic sexual behavior is the National Center on Sexual Behavior of Youth. That's the very top one, ncsby.org. They have great information about kids of all ages. They have stuff for parents, they have stuff for therapists, just all kinds of things. Some of the others, the nctsn.org site is just about trauma in general. So there's a lot of stuff around sexual abuse and sexual behavior. The Tennessee CACs have some good information as well. And they were part of our work group that developed some guidelines around this. And then those brochures that I talked about by Toni Cavanaugh Johnson, she has her own website, tcabjohn.com. So for ToniCavanaughJohnson.com. So there's brochures you can order or print stuff out just to have some materials to give families. That is it. So any questions or comments?
Something that we've been coming up against at Youth Villages is finding some additional providers that will work on this problematic sexual behavior. So do you know if there's resources across East Tennessee where we can kind of pull to get kids the support that they need with that?
Yeah, that's such a good question, Jenna. And it's something we've recognized for a long time. We've tried bringing providers in to do kind of special workshops. We've done our own workshops for therapists, trying to give therapists the message that you too can do this, right? I think there's kind of a concern among child therapists that this is not their specialty or this is not what I was trained in. And this kind of belief that this needs to be specialist training, with with kids in particular. And it doesn't need to be. Like, again, this can be done by anybody. We think, most outpatient therapists should be able to provide this kind of treatment. So, so the answer is there should be lots of people, but I understand your concern, and I understand the therapist saying, yeah, no, I don't do that. So I don't have a good answer for you. And, most of the specialists around sexual behavior are for either adults or adolescents, and like residential facilities like Stepping Stone. And most kids just don't need that. They don't need that level of care. So, one idea might be, if a therapist is open to receiving materials, like if you could direct them to some of those websites around best practices and, sort of let them know, well, I've heard that most therapists can, blah, blah, blah. The COE says most child therapists should be able to do this. And here's some resources, if they'd be open to kind of looking through some of those things. Sort of my best suggestion. I don't know if other COE folks have thoughts, or anyone else on the call has thoughts about kind of how to tackle that issue if therapists not being comfortable.
I mean, one of my thoughts is looking for a therapist that's maybe trained in TFCBT. They might be more likely to be open to that. I mean, there's no guarantee.
Sure.
And the kids who have problematic sexual behavior don't need TFCBT necessarily, but a therapist trained in that might be more comfortable. Would be my thought.
Yeah, that's a great thought, actually. Yeah, because they work with kids who are sexually abused and who often have problematic sexual behavior, right? So they do get some training in that. Yeah, that's a good thought. Steve has a question in the chat. How do you deal with the sexual messaging that kids are constantly exposed to on the internet? Great question. Tell parents to limit their access to the internet. And I know that the parents don't always have control, but over kids, elementary age and younger, they should have a lot more control than you do in maybe adolescents. Controlling their phones, if they have, getting them phones without internet access or things like that, so that, they're not, you can try to limit as much as possible what they see online. So with, their tablets and phones and things like that, I am always talking to families about restricting that. Don't let them take it to their room, right? If they want to use their phone, a lot of parents want their kids to have a phone so they can reach them. And so, we're seeing younger and younger kids having their own phones and things like that. But there are options for, phones that only call certain numbers that don't have internet access. And then just certainly at home, of course, watch what you watch as parents. Be mindful of what you're watching when your kids are around. Sometimes parents think, oh, they're not paying attention, they're playing, they don't know what's going on. They pay more attention than we think they do, and they know more than we think that they do. So trying some of those strategies. Good question. All right, well, I realize we're sort of past our hour, so if you have questions, I can hang out for a minute, but otherwise, thank you for your attendance. Please don't forget to fill out the survey that was dropped in the chat by Kris. We appreciate those surveys, and we use your feedback to kind of pick our speakers and so forth. So thanks, everyone.
And just a reminder, next month, we will have Dr. Christina Beaton coming to talk to us about school avoidance. So should be a good talk for next month. So come back and see us again.